most people that get COVID-19 have either a benign or significant illness, but mostly it's self-resolving and people get better under their own steam. But a certain proportion of patients, the immune response to the virus becomes exaggerated, leading them to get adult respiratory distress syndrome, require ventilation, and require management of that situation. And so it turns out that if you take an aerial view of what we've been doing in myeloma in other areas, you get some real different insights. And one of the insights that we got was if you use CAR T cells or bispecific antibodies, a proportion of patients develop this cytokine release syndrome. And that has very strong similarities with what happens with COVID-19 patients who become seriously ill. And so it was natural that the management approaches we've been using for CRS that we look at for COVID-19 patients. And we know in these cytokine release syndromes that IL-6 is a major cytokine that drives that whole disease process. And in kind of CRS in myeloma, it's been shown that anti-IL-6 drugs or anti-IL-6 receptor drugs can help abort the syndrome, and if given early, can prevent the syndrome occurring. So on the basis of success in similar disease entities, it was natural people would try to use these drugs for COVID-19 patients who have become really sick. And it makes sense to evaluate these drugs properly so it's not just anecdotal evidence. So there are now a number of clinical trials looking at the role played by these cytokine inhibitor antibodies in the treatment of the severe phases of COVID-19. And I suspect they're going to be successful.